Let's see, today is December 30th, I think, Sunday. So that means it's been be 3 weeks Tuesday since the second surgery, um, where they made a incision like a C shape behind my ear and um, took fat from my belly, not nearly as much as I wanted, but anyway, and stuffed it into basically the vacant space that where the tumor had been, because my cerebral spinal fluid was leaking out, which can lead to meningitis and other bacteria getting into your brain and pretty much kill you. Um, I was doing good up until I had to have that second surgery, and for some reason it just whipped my butt. I'm telling you, it was a outpatient surgery. I was there. I mean, I stayed overnight, but the surgery didn't start till like 4 o'clock in the evening, and then I was in surgery a couple hours. Stayed overnight. The boss picked me up about 9, I think, the next morning, 10, something like that. Felt pretty good that day. I'm thinking I felt pretty good the day after, and then I just crashed emotionally, physically, spiritually, mentally, all of it. Probably one of the hardest things I've went through. Um, I know it's hard to understand probably if you're not there, because I never thought that I would react this way to a surgery like this. The facial paralysis is the worst thing for me, um, and it's not the looks. Well, I mean, don't get me wrong. Of course, part of it's looks, but the majority of it is the eye. Not doesn't blink like it should. Doesn't can't close it all the way the majority of the time. So I pretty much live with putting either an eye patch on, and I did find some like Band-Aid like ones, so that helps, or just putting eye drops in like every half hour, which sucks. I have an ointment I put in at night, and then I put an eye patch on to sleep, and then usually a sleep mask over that to make sure the patch stays on. I don't really have any pain anymore. Every once in a while, if I sleep wrong or something, one of my incisions may hurt, or, well, actually only one, the one behind the ear. The one behind my head doesn't bother me at all. You would think that one would have been so much worse because of it was a so much more invasive surgery, but hey, what do I know? Planning to go back to work on January 2nd. That's not happening. Um, I see the neurosurgeon on the 2nd, and hoping he'll at least clear me to go back at part-time starting that next Monday. So whatever that is, the 8th or something like that. I know that's probably not what you wanted to hear, boss, and especially you, Melvin. But I'm trying. Got out for the first time last night in 10 days. That tells you how bad I was. I don't think I've ever spent 10 days without being outside in my entire life. The fatigue is overwhelming, which I was warned about. So I was prepared for it. I was kind of prepared for a little bit of facial damage. I think the percentages are like 10 to 15%. However, I guess since mine was worse, the tumor was in a worse place than what they thought. They had to cut the facial nerve completely and then graft it together. And that's what we're waiting on now, is to see if it will regenerate itself. I feel zaps and tingles every once in a while on my tongue and my lower lip. And I think that's a good sign that means it's trying to grow back together anyway. But it could be 18 months or more before they know if it worked, which I think is, well, as you all know, I'm not a very patient person at all. And 18 months is a long time to me to have to wait to see if I'll ever be able to eat normally again, or go outside without putting a patch on my eye, or any of the things you take for granted, really. I can't smile, full teeth smiles like this. Just a small smile. Can't even do that. As you can see, the right side of my face is totally dead. The trigeminal nerve controls sensation, so I can feel that side of my face. However, the facial nerve, which is the one that cut, controls the movement. And I thought a few days ago I felt a little movement at the corner of my mouth, but I don't know, and all we can do is wait and see. The next thing is the eyelid. They have what they call eyelid weights they slit your eyelid and put small gold weights in it to make your eyelid heavier. Therefore, it helps it shut. Because if you can't blink your eye and you can't shut your eye all the way, it dries out, which damages your cornea. I mean, that's what blinking's for, is to protect your cornea and to re-wet it. And I definitely don't want to, be deaf and blind on the same ear, or on the same side. That'd be lovely. When I went out yesterday, I had one of those Band-Aid eye patches on because the wind was so bad, and then some glasses that I borrowed from Maria that have sides on them to help keep the wind out. And once we got in the store, I could take the bandage off so I could look around, because unfortunately that's also my good eye. My left eye is the bad eye. So I was glad I was able to walk around the store for about an hour. Normally, I noticed before, being in a store dries it out pretty quick. I don't know if it's their air systems, circulation, or whatever, but it dries it out pretty quick, but it didn't. We were in the store for probably an hour, and it just started to, get itchy, and where I could tell it was dry right before we left. And then after I paid for my stuff, I slapped the eye patch back on and couldn't wear the glasses because by that time it was dark, and I'd have killed myself trying to walk through the parking lot. But I did it. I feel better. It's just been hard. It's been hard not being able to do anything. The fatigue is just, I have narcolepsy anyway, but it's nothing. The fatigue is just so overwhelming. And it's like, even you're mentally fatigued. You're tired. I don't know if it's because your brain's compensating for the other side, which is one of the theories, but it's just overwhelming. And then I think the emotional part of it was it being Christmas, and not a whole lot I could do for the boys. They're older, 20 and 14, so they understand. But it wasn't any big party around here, that's for sure. It's just me, the hubs, and the boys, and they opened their presents. One of the locals had donated Christmas dinner to me, so all I had to do was heat that up, and we had that, and that was pretty much our Christmas. I just feel like by being like this, I'm taken away from the boys, or their childhood, which, let's know, they aren't really children anymore, but still, I don't know, you moms will know what I mean. And even, they've been understanding. Even they were saying, Mom, this is one Christmas out of all of our Christmases. It's not like this happens all the time. We know you're like that. But, as a mom, you have that guilt feeling all the time that you're not, or at least I do, of not doing something, like I should be up cleaning, I should be up doing this, I should be playing cards with the boys, I should just be doing something. And up until 2 days ago, except for Christmas morning, I hadn't even left my bed. I've watched more TV in this, 5 weeks than I have watched in the past 5 years combined. And I'll just tell you now, there's nothing but crap on TV. like I posted yesterday, ID Discovery. I could kill you 500 different ways and never get caught. It's pretty much all I watch. ID Discovery. Occasionally I'll catch a Law and Order SVU, something like that. Haven't had much interest in reading, and I think it's the whole vision thing. I had this whole list of things I had planned on doing, during my recovery. I thought, after a couple of weeks, I'll still have like 4 weeks off, and I'll have, all this stuff to do around the house, spray paint these things, do this, do that. None of that's been done. I don't know. It's been a lot harder than I ever imagined. And I wouldn't wish this on anybody. I mean, it's not just the physical, it's the mental and the emotional and the, because it's such a rare tumor, there's not a whole lot online. And, I don't know, but I'll persevere, just like I have so far. And if my face is like this forever, I've learned how to eat, I can drink, I won't like it, but I'll deal with it. At least I'm alive.